infectious disease and internal medicine working in Czech Republic in the US. And yes, IKEM, Institute of Experimental and Clinical Medicine, is a leading transplant center in the Czech Republic and Center for Cardiovascular Surgeries and Diabetic Center. So I was basically, I happened to be in charge of protecting this institution against the coronavirus. My experience with the hospital epidemiology is broad. However, I do not have much experience with treating people with coronavirus. That I'm happy to leave to other specialists. And I have some experience with how the country managed. And we also, of course, are quite proud in the Czech Republic that the epidemic was put under control quite in time and had success in that. And I have contacts to people who directed it, but I'm not personally involved in directing. You know, I'm not in charge of controlling the epidemic in the Czech Republic, just to understand. But of course, we are all informed about the steps of the government. So that's just to clarify what my position is. Obviously, I do remember quite well, you know, how it all started, because I happened to be actually in the United States when it started, and I landed in Prague 2 days, or actually a day before the lockdown began. So I remember how kind of easygoing the people in the United States were about it, and how quite underestimating, retrospectively, I have to say, were a lot of people about it, including me, and how this all changed in the days when it started. We followed the situation in Italy. I think the Czech Republic was quite, I should not say happy, but lucky enough to witness and to be informed about what happened in China, about what happened in Italy. You know, the coronavirus was introduced to the Czech Republic by the skiers, because the Czechs are very fond of skiing and going to the Italian Alps to ski. So our first cases, I remember the first case in the Czech Republic was, while I was still in the US, was detected from somebody who was in Italy and basically brought the coronavirus from the northern provinces of Italy, where the mountains are and where the skiing slopes so popular among the Czechs are. So this is how the coronavirus got into the Czech Republic, and then it spread. Our main task, basically, and we always stress that the most important for us hospital epidemiologists are protect the hospitals from the infection and protect the senior nursing homes, which we're also in charge of, because those are the most critical places where the coronavirus can spread and kill. I would also like to stress that you know, there was a lot of people who were comparing this virus to a flu epidemic, and I think they were wrong, because this is certainly something completely new, and with some aspects which are better, but certainly many that are worse and that are worrisome compared to the flu virus. I got some questions for some people before the talk, so I can answer some of them, and then I leave the field for whatever you want to ask us. The first question was about comparing this to the SARS virus in 2002, and a respected Russian pneumonologist recently said in an interview that the coronavirus was going to stop in June and does not come back earlier than in a decade. If we,
I would like to ask you, can we already see the future in an optimistic way regarding the current pandemic? Because, for example, a respected Russian pneumologist said recently in an interview that the coronavirus was going to stop in June and doesn't come back earlier than in a decade. So is the time for some optimistic prognosis?
There is so much time for all kinds of prognoses, yes. But you know, as we all know, prognoses are many times you know, wrong, and I would hate to be somebody who's saying that everything's going to be good and nothing will come back. Well, there's certain factors in this virus that we have to take into account. Okay, He compared it to the SARS virus, to the SARS epidemic in 2002. Yes, this virus is also called SARS because it's a severe respiratory virus, COVID-2. So there are some comparisons. They're both coronaviruses, but the ones that caused the pandemic this year is way more infectious and has lower case fatality rate than the SARS virus in 2002. What does that mean? That means if a virus kills less people, it seems, of course, it sounds much better to all of us. But the fact that it kills less people means that it stays longer. Viruses that kill a lot of people, like Ebola, usually are contained because they don't spread that much. This virus is certainly better as far as infecting someone. The case fatality for SARS was 10%. This virus is 1%, meaning how many people of the infected one it kills. But it's also more infectious. And the very important point I have to stress is that this virus has asymptomatic, we call it asymptomatic spread. It means that you don't feel anything, you feel healthy, and you have coronavirus, and you can infect other people while having no symptoms. This was not the case of SARS in 2002. In SARS, all the cases that were detected were infected by people who had some symptoms, who were coughing, who had fever, who had joint pains, who had symptoms like other virus infections. So any comparison to the SARS epidemic in 2002 are already lagging and are difficult to make because this is different. Yes, they're both coronaviruses. Every winter we have coronaviruses. Coronaviruses are very common viruses causing very mild epidemics every winter, causing very mild infections every winter. But this is different. So the other important factor we have to stress that we now can say already with certain predictions that a lot of people who got coronavirus do not create many antibodies, or the antibody response that we have probably is not lasting too long, which means that yes, you can have coronavirus, you can get infection, and in 3 months from now you don't have any antibodies, so you're not immune, you're not protected, and this creates kind of the milieu for the potential other waves that people are so afraid of. There were big second waves in the Spanish epidemic in 1918, the Spanish flu. There was a big, winter wave. And although a lot of people say that this virus has nothing to do with the climate, generally coronaviruses do have a lot to do with the climate. So UV light kills the virus because it's an RNA encapsulated virus. So it's very sensitive to the environment, meaning light and warm is probably not good for the virus for the climate. So it is possible, yes, that during the summer months, when it's going to be dry, and in the Czech Republic we're expecting to have a very dry summer, and the UV light with a lot of sunlight may help suppress the virus, but it can start again in the fall. There's so many. It was
my other question, that will there be a second wave after summer, or even more waves?
Yes, we get these questions over and over and over and over. I think that everybody who tells you yes, there is going to be a second wave is kind of he's not telling you that he doesn't know. I don't think none of us knows whether there's going to be a second wave. I think the virus is going to be around. We'll still see cases now. Even in IKEM, we still see healthcare professionals who still get infections. It is still here, and like I said, with the fact that there is not a lot of antibody response, the virus is circulating. There is still a little outbreaks, and what I'm mostly worried about are the outbreaks in nursing homes and hospitals. So I think in this situation will be for another couple of months, when there's going to be case here and there, very much contained, very much under control, meaning life will go on. We are already in the phase of easing the restricting phase of the epidemic. So we are opening shops and restaurants are opening, but there's still going to be cases. We just have to make sure the cases don't overwhelm the healthcare system. This is called the flattening the curve, which I'm sure, a lot of you know what that is now, the meaning that you get the epidemic under control, but it doesn't mean that the virus will go away. I don't think so. There's some people who believe it will. And of course, the fall, with people relaxed again, saying, okay, it was just this, spring thing, and it went away, and people will forget. And we know that people have very short-term memory sometimes. and the winter climate, the fall climate with the humidity and the temperatures just above zero will make the climate again, much better for the virus to go on. And if we're not vigilant enough, certainly we can talk about a second wave. I don't personally think that the second wave, if there's going to be one, is going to be bigger than the first one, because we already know, some facts. We are not in 1918, we are in 2020. But like I said, it will be here, and it can cause a wave, yes. But nobody can tell you. If they're telling you they know, they don't.
Well, thank you, doctor. Well, to what extent are the restrictions necessary?
The restrictions,
were they exaggerated in the Czech Republic and other European countries, or did they help along with other factors to decrease the number of those infected?
Yes, thank you. The imposing of the restrictions, which in epidemiology terms is referred to flattening the curve, meaning that you suppress the exponential increase in infecting the people, because the R number, we talk in epidemiology, it's called the R number, which means how many people one person can infect. When one person can infect 4 or 5 people, it's like a nuclear reaction, okay? This is when the curve starts, and this is where you have to impose the measures, because every day counts. This is what did not happen in Italy. This is probably what likely did not happen in Great Britain, in big cities, and likely did not happen in New York and big agglomerations in the West in time, okay? They were hesitant about the restrictions, and because every day counts, like I said, it's very important, to take the measures and restrict and impose the quarantine measures in time, because if you do it a week later, it's out of control and your healthcare system is overwhelmed. So that, I have to say, the Czech Republic did exactly right in that time where it's supposed to happen. They also look at the situation in Italy. They already knew how it was in China. Although I have to say the Chinese, many times did not give the information that was very accurate. And so that was fine. That was good. And I think it was March 14, March 15 or something. They really closed down everything. Tell people, you have to mask yourself, which was mandatory in the Czech Republic and still is, and is going to be until May the 25th. They told them to keep social distancing, washing hands, and mostly stay in house.
So that's it. You mean that taking action soon or closing the borders was why have Central European and Eastern European countries been able to control the spread of the pandemic better than Western European or South European countries?
Yeah.
Can you explain us what was in Czech Republic special and successful in controlling pandemic?
Yes, like you said, I think that's 90% of the success is really the timing of imposing the restrictions. The timing, because of the exponential threat, is absolutely essential. So the timing was right in the Czech Republic. The timing was wrong in Italy, and the timing was wrong probably in Spain.
In Spain, of course, yeah, it was.
Yes. The timing, of course, also refers to the government looks at the timing of imposing these measures as referring to the quality of healthcare, because if you have so many ventilators and so many nurses operating the ventilators, if you have high quality healthcare system, you may be in a better situation. But we know that Northern Italy has very good healthcare system. Even Spain does have a good healthcare system, but the timing was wrong. And once you have so many patients coming to the emergency room with the same symptoms, and you don't have oxygen, you don't have ventilation, and you don't have staffing to take care of these patients, you're in the disaster, which we call now the Italian scenario. That did not happen. We really had, the cases we had were distributed among the hospitals, even the ones that had to be ventilated. The capacity of the Czech healthcare system was not overwhelmed at any point of the epidemic. The numbers were increasing. It took about 2 to 3 weeks to see, some effect of the measures, which is usually with the incubation period being up to 14 days. And then the number started to go down. So we certainly had success. We didn't see what the Italians saw, what people in Great Britain and Spain saw, and I think it was due to the timing of the measures. The other fact is also that the people were scared, and people, maybe it's a mentality in Eastern Europe that they kind of, you know, when they're afraid, they listen to the authorities. That for example did not happen in Sweden. You know, Sweden, I'm kind of always looking at, you know, because it's a country that took a little different way than other countries. In Sweden, they were only recommending certain measures. They were not imposing them. But I think, you know, in the Czech Republic, imposing measures very, not a dictatorial way, but a very government kind of imposing way helped. And maybe it was a little too much at times, and maybe the government response at the very beginning, and I'm not talking about imposing the measures, I'm talking about distributing the protective equipment, the masks, you know, that we had shortages as well. There were problems at the first 2 weeks. What also helped the Czech Republic was the enormous enthusiasm of people helping each other. You know, I remember the Velvet Revolution, and I don't remember being people so nice to each other and so helpful to each other as they were in November 1989. And I'm not talking only people to people. We had institutions, for example, our hospital did not have enough testing. You know, the testing is important as well. We then had Academy of Science next door to IKEM, and the Academy of Science that said, oh, we'll do testing for you. They usually do research, and they switch their laboratory work hours to testing for us. So, you know, and some people were doing the masks. You know, we had companies that were doing 3D shields and, you know, all kind of personal equipment, which we had shortages as well, like everybody else. But people and companies help each other. That was the second factor of the success of the Czech Republic, that the people were not just sitting home being scared, but were actually switching productions in companies and startup companies doing stuff they were never done before. So I would have to say, yes, the government did very well imposing the measures in time, but also, and maybe that's even more so, I have to say, the people and the institutions realized quickly that without helping each other, with the shortage of equipment, because we had, yes, the government had some supplies from China, but they took so long and the tests were not really very high quality what they sent us. So it was the help of the institutions and people to each other that put us through. That's certainly a big factor that I think was also noticed by some other countries. And in my view, the compulsory masking, you know, that's something very interesting that not many countries did it, that they really mandatory.
In Spain, for example, it's just recommended to wear face masks. You mean that face masks also help the Czech Republic control pandemic crisis?
Yes, I do. I saw some studies on the mask. I mean, there's so many stuff, and they really do make a big difference, because this is a droplet spread of the virus. You know, it's droplet and contact. I mean, you can get infected by touching some surfaces like door handle and all, but the most of the infection is actually droplet. So you're breathing, you're coughing, and putting masks mandatory. Actually, I agree with that. You know, I'm a very liberal thinking person who doesn't like to, you know, and the Czechs are kind of, you know, we're known to be a little laid back people who historically don't like to listen to governments, because we have, you know, bad experience with governments. And this was really very interesting, because, you know, a lot of the government steps were actually very good and very accurate. But with this mentality, you know, I was a little worried, because I was thinking, well, the Czechs will say, oh, the government says one thing, and we all how the government's always, you know, in the 20th century was saying something which it did for its own purpose. So I was worried that the people would not actually, you know, wear masks and would not obey, because they would underestimate it. But maybe they were afraid, or maybe they trusted, and it was very good that they trusted, but they really put the mask on and kept the distances. And it's still going on, although now with losing the restrictions, people are getting, in my view, a little more relaxed than I would like them to be. But yes, the masks made the difference also. I believe in masking, actually. I'm one of the people who thinks that this is absolutely, as well as hand washing, you know, and social distancing. There are three things, because a lot of people think, okay, if I put the mask on, that's it. No, you should also wash your hands if you remove the mask, and you should also keep the distance. So we still stressing these three things, and I think the mask did make a difference. Yes.
I think that the help of face mask is obvious, and I understand. I don't understand why other governments also order to wear it. For example, in Spain, it's just recommended. Some your colleagues explain to you why other governments react by this way.
Mm-hmm. Mm-hmm. I don't know if you're imposing already, you know, so many measures. If you do the lockdown, as we say, you know, masking is how a big difference it makes. It's such a small thing for people to do that I think I totally agree with the mandatory masking. Yes, and I think they did make a difference. And yes, you know, it's interesting looking at different countries. You know, of course, how different, because it has a lot to do with cultures. You know, there's some people who say that, for example, you know, India didn't have many cases because people are greeting each other like that and don't actually shake hands. There are things people believing in Sweden had actually not such a bad scenario, despite, you know, not mandating a lot of things, because, you know, it's not a populated country. A lot of people live alone. So, you know, every country has a little different culture. And on the other hand, this, you know, people in the south, as you know, in Spain and Italy, like to be together. They, you know, they take care of their elders. They live in big families. The spaces they live are smaller. They're not so spacious. And we all know the space makes a difference, because even in hospitals, you know, we have problems in the Czech hospitals because the hospitals are old and small, and the distance between the patients sometimes is not big enough because the distancing make a difference. So those are all aspects you take into account during the epidemic. And that's why I think that the numbers are so different in many European countries, you know. Also statistics, the way, you know, statistics is measured, or the cases, the infection cases, and the death, the reasons for death for many people is counted differently, and you see big difference. But I think there's certain things that, I don't see you now, I'm sorry, but yeah, there's certain things that you can certainly say that play big difference, and that is imposing the measures in time, you know, keeping social distance. Having elderly population is always wrong, you know, it's always bad. Having a lot of people condensed in one place, that's why big cities like New York, high-rise buildings, you know, make a difference. I think that also is the difference between Western and Eastern Germany. You know, a lot of people say the TB vaccine played a role, which you know, helps with the innate immunity. I don't think so that much. I think it's the way of life that actually predisposes for the epidemics. So a lot of people in one place, you know, a lot of mixing of people, which are a lot of people with risk factors, which is obesity and hypertension. Those are all aspects of the Western society and of the civilization we live in, and they actually make good conditions for the virus to spread, you know. And that's why some countries did better, some countries did worse. And also testing, you know, I have to say, I'm sorry, I'll let you give me some questions, but testing was very important at the beginning. You know, you have to know who has the virus and who doesn't. And because we know that a lot of people carry the virus and actually don't know about it, the asymptomatic spread, very frequent testing of people as much as possible makes a big difference in tracing and isolating the people who have the infection. And countries that did a lot of testing did better in the epidemic. I think that was the success of, you know, Asian countries. And the Czech Republic and Germany, you know, tests a lot. And then you see a lot of positive people, because if you test a lot, there is a lot of asymptomatic people who become positive. So a lot of people say, oh, how come Germany has a lot of positive people for COVID? Well, because also they test the people. You know, why does African countries have very few? Well, if you don't test the people, you don't know where the virus is. So those are all factors you have to look at when looking at the numbers. But testing in the Czech Republic is still one of the problems, I would say. And sometimes I critique the government in many ways, because we still don't do enough tests in those, you know, areas like the nursing homes and hospitals. So there's still, you know, there can still be problems. We're not behind. People are relaxed now, and we think, you know, it's over. And maybe some people even say, oh, it was so mild that, you know, what the big deal was all about it. But of course, the big deal can still come. You know, I'm not saying it will, but we have to be cautious and test the people and make sure, like in the hospitals, every admission to the hospital we test. You know, we have to test whoever does very little symptoms, test immediately, because we have to know where the virus is. And I think that's the key of success as well.
Petr, may I ask you, how close are we to a possible vaccine, or at least a medicament to beat the virus?
Yes, although I have to say, although the institution I work for, IKEM, you know, came with, it was a big conference of our health minister with one of my colleagues that IKEM is participating on developing a Czech vaccine. Okay, I think that to say skeptical is a very mild expression I have to use. The shortest time for any vaccine in the past was years. You know, it was, I think, 3 years. I don't even believe that a year is enough with all the steps you need to create a vaccine. And certainly Czech Republic by itself, as much as I am Czech and I would love to have the vaccine in a very short period of time, I don't believe it. You need a big company, you need a big country, you need a lot of investment, and you need a lot of time. Certainly, you know, not months or weeks, as some people say. We are in 2020, of course, so it may be 2 years, maybe a year and a half, but that's the most optimistic I think we can be. You know.
Well, and how will our lives change?
I always say
after pandemic.
Yes. Thank you, because I always say we have to always take the best out of what the situation we are. In medicine, for example, I was in the Czech Republic always a critique of many things we used to do for years, and we had old professors who say this is the way we did things and we'll be doing them because they work. And obviously these things did not work. This epidemic made a lot of exposed a lot of things that we need to change. For example, you know, there's a lot of unnecessary visits to the doctors in the Czech Republic. Czech Republic is known that, you know, a lot of people visit their doctors and it's free, and they come for a chat and they say, oh, my knee hurts, and then they go home and the next day they come back because they can. We are now, for example, in IKEM pushing for telemedicine, meaning you can talk like we talk over the computer. A lot of these visits can be done over the computer. A lot of the questions patients have, you know, can be done through the computer. Not everything, but there's certain, you know, limits to people come to the hospital, because hospital is a little, you know, dangerous environment. There is resistant bacteria, there's viruses. So that's one good aspect I already see. It's people changing the mentality, thinking maybe I should not come to hospital unless it's absolutely necessary. Maybe I should really wash my hands every day I come back from using bus or underground or, you know, big spaces. Maybe putting masks is not only good in Asia because we know the Asian people do it, you know, often. Maybe we should do it as well during the winter times. Maybe I should also let myself get a vaccine against the flu in winter months, because Czechs don't believe in vaccinations. A lot of Czechs are very skeptical in vaccines generally. You know, Czechs are quite conservative people. And suddenly a lot of people come to me and say, oh, I'm certainly going to get the flu shot. I wish I had a coronavirus shot, but we don't have it. But at least I can prevent some other diseases that are preventable by vaccinations. And people kind of people believe in science suddenly. You know, some people who, you know, came with ideas of natural lives and refusing vaccinations, and in the doctor's views, those are sometimes quite dangerous ideas. They are changing mentality. Okay. So I see some good things that can come out of this, like people focusing on hygiene and people maybe adapting their lives to, you know, living in thinking that, you know, nature is something we have to count for. And of course, the other good things we all see, that suddenly people noticing they can hear birds singing, you know, so loudly they could never hear them before. And China, it doesn't pollute the world as much as before. I know to talk to people in Spain about these positive things is, you know, quite dangerous. And I'm sure in Spain, people would laugh and say, we just been through hell. So why are you talking about positive things coming out of the epidemic? Of course, there are very few, but there are some, you know, and we have to also make sure the healthcare system for us, healthcare professionals, we know how to use protective equipment. You know, there's so many things the epidemic uncovered so many things we were not focusing on. You know, I can tell you interestingly, what I do and what I teach also is something called hospital-acquired infections, meaning you get some resistant infections while you're in the hospital because of the healthcare. And suddenly we see much less hospital-acquired infections than before. And the only reason we found out is that even the doctors or nurses are now washing their hands, and they're putting masks, and they're putting gowns, and they're putting gloves, So it helps us prevent other infections if we focus on hygiene as well. So me as a doctor, I see quite, and of course we haven't seen things people have seen in New York or in Spain and Italy. So maybe we talk about the better things. It's easier for us, but yes, there's quite a few good outcomes in as far as people changing their lifestyles because of the epidemic. But I wish there was no epidemic. Of course, I wish there was no pandemic. I wish the life was as before. But let's take the best out of it. Let's maybe change our lives. Let's change our systems we live in, our healthcare, so that we better prepare, because this is going to happen. This is going to happen, again. This happened in the past. Why should not happen again in the future? And we
like Alexander Shushalin said that it repeat in one decade, so we can live 10 years and be okay. It's also possible.
Also, some of the flu, some of the years the flu is pretty bad. The people, maybe you remember the swine flu 2009. Was a pretty bad flu. I mean, flu can be devastating for a lot of patients. And we can vaccinate ourselves against the flu, and we don't do it, and we underestimate these things. So it doesn't have to be a new virus. It can be just a bad flu virus. So, it's and a lot of my teachers in infectious disease, they would always say it's not going to be the bacteria that's going to be dangerous for us, because we so much talk about resistant bacteria to antibiotics, but they say it's going to be some virus that's going to be, the bad infection. And it seems like, we sometimes underestimate viruses. They're, they can be very bad. So
thank you very much. Are there some questions from our guests, our followers? Well, here is one on the chat. Danny, are there some questions?
Hello. I see.
Well, from Vera Pokorna. I can read that. I'm a private ENT doctor in Děčín. At the beginning of COVID-19 pandemic in Czech Republic, it was impossible to buy any protecting devices as the government decided to forbid selling them. I couldn't buy and get respirators, masks, disinfections, nothing. That was a terrible situation. We have to rely on the help of our patients and good people. I believe that was a terrible mistake.
Yes, I actually have to say I quite agree with the doctor.
Thank you, Vera.
Vera, yes, Vera, I agree with you. I kind of became known in the Czech Republic because of a Facebook post I put on my Facebook, being very critical of the first 2 weeks when we also had nothing and we had to help each other. I can only applaud the government. I have nothing but applause for the government for the timing of the measures. That is undisputable, and it was absolutely perfect, and it saved so many lives that, as we can see, many governments couldn't do that. I cannot, however, applaud the government that much for unpreparedness as far as protective equipment. This was something we were actually criticizing, not even before this epidemic, for many years to come. I was comparing the Czech hospitals to American hospitals. There was always protective equipment, and I can see not even enough, as my colleagues in the US. There were always enough gloves, there were always enough masks, and there were gowns, and there were something we call negative pressure rooms, good isolation rooms in hospitals where you could put a patient with a suspected, contagious disease. The Czech Republics don't lack this for months before this. And certainly without help and without this, the outcome would be worse. So I think it's a lesson for the Czech governments, and I'm not blaming this specific Czech government. There were many Czech governments in the past who were telling there's not enough isolation rooms, there's not enough protective equipment. They will always say, oh, you know, it's enough for the flu season, it's fine, etc., etc. That was something that really the first 2 weeks people had to help each other. I also think that the fact that the government have to buy centrally, you know, the equipment, and they bought it from China is not a very, I don't think it's very practical, because I think if they let the hospital administration decides where to buy the protective equipment, it would be faster. A lot of countries can do it. Maybe the Czech government doesn't trust the hospitals because of, I don't know, fears of corruption. So they have to buy everything centrally. You know, it's the central purchase and distribution. That just made things slower, in my view. You know, we really were waiting for the shipments to come and distribution, and I'm working in, you know, one of the best hospitals in the country. People from smaller hospitals were telling me things, and people in private practices, they didn't have it. They had a mask for a day, a very bad mask, which is even risky, you know, because using this paper mask for more than an hour when you moving it and it's getting moist, it's even more risky than beneficial. So, you know, I'm not forgetting these critical days at the beginning. And as I said before, I don't think that without institutions helping each other and people completely changing the production of their companies, and, you know, I don't know, actors, you know, and artists sewing masks because they couldn't be in the theaters and you know, doing their art. This help was absolutely critical to the success, you know, of this. So it's the timing of the measures, absolutely, but it's the protective equipment, self-help, you know, that also made a difference. And the Czechs were fantastic about this. This was absolutely, I'm sure every nation can do it, you know, but yes, I'll have to let somebody.
There are other question from our colleague Lucie Kuligová, director of Czech Center in Athens, in Greece. Can you ask you, Lucie, or you have a microphone closed? No, it's not possible. So I will read it. Lucie Kuligová, our colleague from Greece, is asking you. So if we become infected and we will recover, we will have immunity for some time, right? Do we know for sure for how long? Is it good to go through it because we will be able to calm down afterwards or not?
Yes, thank you for the question. Again, the antibody response, the immune response of your body to the virus is probably, and I'm saying probably because we have very few studies on that, is probably related to the viral load, you know, you get when infected. Meaning, if you very sick and you became very sick because of a likely big viral load that infected you, somebody really coughed on you a lot of virus, or you as a healthcare worker were exposed to continuous, you know, viral loads from your patients or from your colleagues, you became sick, and the immune response you amount to or you create is likely related to how much sick you were and how much virus there was in your body. So the milder disease you have, the less antibodies you will have, and the quicker, you know, decrease in the number of antibodies you will have. So that's why, you know, a lot of cities, the call of the measuring of the herd immunity, which we had in the Czech Republic, which meaning how many people have antibodies, you know, ended up in the Czech Republic. The number of people having antibodies is very, 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 very slow. You know, the tests were not perfect. They were Chinese tests, so they didn't catch up some antibodies in some people. But the answer was clear, and that's what the government wanted, was the answer of no, there's no herd immunity because there is no antibodies. But in places like in New York, you know, where the people were sicker, they do have antibodies. How long do they last? That's the question. I think that's a little early to tell, but it seems from the cases I've seen, you know, and they were not severe cases. We had a healthcare provider who became quite sick and tested negative already 3 weeks on the Chinese antibody test, and then an ELISA test, which is a more specific test, had some mild positivity. So it could be weeks and months, and you're not immune. I mean, you know, it's really too early to tell. but very likely the antibody response is, you either have to be very sick to have a good antibody response. And that's not good, because obviously, that's just that is a factor speaking for the possibility of another wave or another little waves of the infection.
There's other question from our dear colleague from Greece, Lucia Kuligova. Lucia, hello. Lucia is asking you, there are more and more groups of people who oppose to any vaccination. What is your opinion on this topic? Ask Lucia.
Yeah, thank you, Lucia. I first of all, it's interesting that Greece is one of the countries that actually had success, right, with the epidemic, and I think also because of the timing of the measures. As I was, looking at other countries, that's as far as Greece. As far as vaccinations, this is very dangerous. This is what I hope this epidemic might change in people kind of believing in science. Refusing to vaccine is. I think it's very dangerous, not only for, the individual himself or for the kids, and also for the society, because if you don't, that's the herd immunity. If there's a lot of people who don't vaccine themselves, then the infectious disease spread more. And even for the people who, could not be vaccinated or have not yet been vaccinated, planning to, the virus can get them. And I think people don't believe in it because they don't see a lot of people tell me, I haven't seen a, I haven't seen a case of pertussis or measles. Why should I get a vaccine against it? Well, that's because we vaccinate, you don't see these diseases. And we, even to medical students, sometimes we show them pictures, and people, I think, should be shown as they look at, cigarette boxes with the cancer. They also sometimes look at how badly people can get having measles, or how badly they can end up having pertussis, or any kind of vaccinating disease they would refuse. Vaccinating is good. Of course, there are exceptions. There's certainly some people who cannot get vaccines for medical reasons, but people also hear stories that vaccines cause autism, and there were significant good studies that really show that this is not true. Many times it's coincidence. People say, oh, I got a vaccine and then I became sick. I got a flu and I got a vaccine and I became sick. No, it was most of the time it's a coincidence. You got a vaccine, and yes, you can still get sick from other virus, but this protects you from something you should not really any time get. So physicians, I don't like the trend. And yes, there was a trend, but I'm telling you, with the epidemic, I am seeing people changing their attitude. Seriously, many people would give so much for having a vaccine against coronavirus. And so. Anyway.
Thank you very much, Petr. There are some other questions. No, if not, Petr, thank you very much for the speech and being with us in this difficult time. And I'm looking forward to see you in Prague one day.
Yes, me too. Thank you very much.
Thank
you guys very much. And yes,
for being with us.
Let's hope there won't be any.
If you would like to say something to finish the speech, we have some time, but if not, thank you very much.
No, thank you very much. And let's hope there is not going to be any second wave. Let's hope the summer with everything will disappear in the summer, no matter how.
I hope so.
And let's learn from it. So that's certainly the message. Let's take the positive things out of it. Let's focus on some things we haven't focused before. Let's pause for a while. We had some time to think about ourselves. Let's always realize that nature is stronger than us, and we have to count on anything and be prepared. And let's move on. And thank you for everybody, for all of the people around the world who are applauding the Czech Republic. I think mostly thank to the people, to the Czech people and their attitude towards it. This was managed very well.
Thank you very much, Petr. Petr Smejkal from IKEM Medicine Institute. Thank you very much. Goodbye.
Bye. Thank you. Bye-bye.